All right. Well, welcome everyone to our webinar, Framing Youth Mental Health for Well-Being and Opportunity. So glad that you all have joined us today. My name is Kate Shatskin. I am Associate Director of Strategic Communications at the Annie E. Casey Foundation. And first, I just wanted to go over our agenda, which is on the next slide. And talk to you about what we'll be covering today. I know you're probably here trying to get some ideas about how to communicate about youth mental health. Well, you are definitely in the right place. And we are going to start off today by learning a little bit about what you're saying about this topic of youth mental health. And then I want to say a few words about why the Annie E. Casey Foundation is interested in youth mental health and wellness as a part of child and youth well-being. Before I turn it over to our great guests today, starting with Marissa Gerstein-Pino, who will talk about what the research says about effectively communicating youth mental health solutions. She's here as Director of Research Application with the Frame Works Institute. And then we'll turn to a discussion with two young adult advocates who are with us today, Isabel Ohakama and Primo Legasso Goldberg. I'll let them introduce more about themselves when we get to that part, who are going to talk with Marissa about the research and how this might translate into effective practice from where they sit. And we'll certainly be getting to your framing and communications questions today, and you won't have to wait until the end of the webinar to enter those questions. We'd love it if you would use the Q&A window in your Zoom platform so that we can see what your questions are early and often. I will note that we plan to go until 3:15 today, so don't worry if the webinar goes on and we haven't gotten to questions yet. We do plan to make time for as many as we can today, so we'd love to hear from you. And now if we move to the next slide, let's start with this check-in I mentioned. We have a question for you all to ponder since this is a communications webinar. I want to get started by hearing from each of you what are one or two words that you use often right now when you talk about youth mental health. I see we're already started system failures. Great. Let's keep them coming. We'd love to take a look at what you all have going on when you talk about this. I see struggle, support, well-being. Wow, disaster. Yeah, trauma. Right. I'll just give us another couple of minutes since we have so many people with us for us all to kind of take this in. Rampant and thriving. So I see different kinds of words, and I think if you all want to keep going with this, our panelists can take a look and take this in as they think about their presentations and their discussions for later. So thank you all for participating in that and thinking about it. So while people are continuing to think about that and enter their words, I wanted to talk a little bit about the Annie E. Casey Foundation and how we find ourselves hosting this webinar today. Dionisa, if you could move to the next slide. Great, thank you. Well, the Annie E. Casey Foundation, as you all may know, has a mission to build a brighter future for young people, for the nation's children and youth. And that's a big mission. So what does that really mean, and how does that bring us to talk about mental health today? Well, on the next slide, we break that down a bit. Here you see 5 key areas, and what we've done is talk to young people about what it takes for them to thrive, and particularly what it takes for them to thrive by the age of 25, because adolescent research is really showing us that that period of preparing for adulthood and building the blocks of the future really takes until that age. And here are the things that young people really told us were important to their well-being. They needed permanent connections with caring adults and family. They wanted financial stability. They thought it was important to live in a financially stable family and to be able to attain their own financial stability as they moved into young adulthood and started to support their own families. And of course, that takes being able to get a good education and gain the kinds of credentials that can lead to a good job. and then finding those opportunities to exercise their leadership as young people and have their voices heard. But in the center of it all, you see these words, basic needs. And really young people lifted up that that's the foundation of being able to do all of these other things, is being able to feel supported by the systems and the institutions with which they interact to have basic needs supported. And that means not just housing and food, childcare, certainly all those things are critical, but also physical and mental well-being. And that's really how the Annie E. Casey Foundation has come to be learning more about and intersecting with this work. We, many of you may have joined us for a summit we held in April in Atlanta to discuss this topic of youth mental health and how we could move towards solutions. And I wanted to leave this section with a quote from our CEO, Lisa Hamilton, who spoke at the summit. And she said something that really struck me. She said that mental health is linked to every other good thing that we want for young people and that young people tell us they want for themselves. And those are a good education, a good job, good friends, and a space to dream. And then within that, how do we make sure those things are possible for all sorts of different identities and racial and ethnic groups, other kinds of groups, so that we can ensure every young person is positioned to thrive. And that's the task before us. So with that table setting, Dionisa, maybe we could take down the slides and I can introduce our friend Marissa Gerstein-Pino from the Frame Works Institute. And Marissa is going to share some really important insights about how we think about changing the narrative on this issue.
Great, thanks, Kate. I'm going to bring up my slides, always an adventure. So hopefully this works well. Okay, anybody let me know if they can't see them. I appreciate that. Okay, does it look good? Excellent, thank you, everybody. So my name is Marissa Gerstein-Pino. I am the Director of Research Application at the Frame Works Institute, which is an organization that is focused on communicating effectively for social change and working with various partners to make sure that we have a shared narrative around social issues, and particularly for this project or for this discussion around adolescent development. So I lead a lot of our work around adolescent development at Frame Works, and I like to joke that I'm not an adolescent development scientist, but I play one on TV because I spend a lot of time talking about this and talking about how to frame it, and it's very close to my heart. So I am really excited to be here and to get to have a conversation with Primo and Isabel after I'm done talking a little bit about our recommendations. So first, framing is a word that's it's being used a lot by various people and means different things. So I want to just lay out what it is that I mean when I'm saying framing. So framing are the choices that we make in how we present information that then change or cue how people are thinking, how they're feeling, and how they're acting. And framing is really critical if we want to change the way that people are thinking and talking and feeling about a particular social issue. So I'm going to show you an example from a related but slightly different topic, which is some work that we did on framing child mental health a number of years ago now, but I think this work is still really relevant, in which we conducted a nationally representative survey experiment with a large number of participants, and wanted to see how two particular frames influence people's support for effective policies to address child mental health. So what you see on this graph are the two frames. So the first being collective progress and prosperity. So this idea, the frame idea, is that when we do effectively address child mental health and improve child mental health, we all, collectively move forward together. There is a shared prosperity that results from this, and there's a collective benefit. So that's one frame. The other frame that we tested was one around vulnerability. So that message looks something like, young people and particularly, children, and particularly children who are facing mental health challenges are particularly vulnerable. They're the most vulnerable children in our society, and therefore we need solutions and policies that will support them. And then the black line that you see here is the control group. So these folks didn't get any message. And then we asked all of them, everybody who participated, a series of questions about their support for various policies. And what we found was really interesting. So that collective progress prosperity frame, to a statistically significant degree, increased people's support for these effective policies compared to the control group who got no message. Even more interestingly, the vulnerability frame actually decreased people's support for those policies. And when we did some additional work looking at the communications that people who worked in this area were using, the vast majority were using that vulnerability frame. And it was actually backfiring. It was counterproductive to the things that they wanted to achieve. So this is showing you the power of framing, but also how incredibly important it is to test your frames before you start using them, because the folks who are using that vulnerability frame thought it was the right one for them to be using. So we at Frame Works love metaphors. And one of the metaphors that we use to talk about framing is this idea that framing is a key. So you can use it and craft it to unlock people's thinking, to unlock more productive conversations, to unlock thinking about support for important social issues and how we solve them. You can also craft keys that actually lock support, so and lock conversations in, so that you're not increasing people's understanding, you're not increasing their support. So crafting that key and making sure it's one that moves to unlock the door to understanding is really critical. So the first thing that you really need to know, though, and this is where we start all of our work, is what is it that we are up against when we are creating that key, when we are creating a framing strategy, because this is sort of the basis of what we do when we create those strategies. So there are 3 cultural mindsets in particular that challenge our communications on youth mental health. And these are very foundational, fundamental mindsets that actually affect communications around all sorts of different issues, but we really see when it comes to youth mental health. Let me backtrack a little and just say, what do I mean by cultural mindsets? What is that term? So mindsets are the assumptions and the perceptions that we bring to anything that we see, that we hear, new information, events, and importantly, communications, and how we make meaning of them. So I'll talk more specifically about these 3 mindsets in a minute, but just talking, generally theoretically about what these mindsets are and what why we need to care about them, is that 1, they are default. So these mindsets they arise out of our culture. Of course, what we experience also influences what they are, but they are widely shared amongst people who live in a shared culture. And of course, we live in an American culture. And they're ones that a lot of times we can go to right away. So we see a piece of information and we make sense of it automatically with a particular mindset. And a great example of this is individualism, which I'm going to get into it in a second. As I said, they're widely shared because they are embedded in our culture, and because they're embedded in our culture, they're very durable. So new mindsets can emerge, but the ones that are already there are very hard, oftentimes, not always, to displace, and they continue to exist in our culture. So what we need to think about is, how do we navigate around the ones that are not particularly productive, but continue to endure? And the key thing is that we have multiple mindsets. Like any topic, we will bring more than one way of thinking, more than one assumption to that. Some of them are going to be that default, we cue it up right away. Some of them we're going to have to think about a little more deeply. For some people, certain ones are more top of mind. For other people, depending on your experiences, your circumstances, other mindsets might be more top of mind. But there's always sort of a back and forth, not just within our culture, but within people's actual minds about what are the assumptions and perceptions that they're bringing to a particular topic. So I'm going to start with one cultural mindset that challenges your communications, and that is individualism. So as I talked about before, individualism is one of those default ones that we tend to go to. America is the most individualistic country in the world. And individualism pushes our thinking towards assuming that individuals are strictly responsible for their own outcomes and have the most dominant influence over what happens to them. So what does individualism do when we're thinking about youth mental health? Well, it puts the responsibility on the young person themselves, right? They're the ones who need to have not just the responsibility, the willpower, the grit, et cetera, to do well, to overcome challenges, including potentially mental health challenges themselves. And because it's up to them, solutions are personal. They're about changing, yourself or that person's perspective, et cetera, and not based on the resources that young people might need to achieve mental health. And it blocks people from seeing mental health as a social issue. It's just about you and what you need to be doing for yourself. So this leads to making it much harder for people to see the role of policies and resources and supportive relationships. It's about the individual. It's not about the collective. How do we fall in this trap with our communications? There's lots of ways to do this. So one, and we see this all the time, and it's very much, again, embedded in our culture and in that individualistic way that we approach the world, which is these stories of perseverance, and will. So somebody is facing a challenge, they overcome it on their own. And it's amazing how often you see this if you're thinking about that type of communication. Hero stories about that one special person who, against all odds, they made the difference, whether it's a teacher or a parent. And it's not that, parents and teachers don't have a role here, but focusing in on that one person instead of thinking about the wider context. And using choice and control and decisions language in terms of people making choices, people controlling their emotions, people making decisions about what they're going to do. So I'm going to show you an example of this. So, this is an article that I found pretty recently. And I want to say up front, I think Haley Bailey is awesome. And this is not a criticism really of the author either, but it's a great example of an episodic story that really brings that individualistic communication to the fore, right? So it's about how Haley herself is protecting her mental health. She's organizing the compartments of her brain, right? There's nothing here, at least certainly in the beginning and in the headline, about supports and relationships and the way she might be able to do this because she has other resources. It's really just up to her. Later on in the article, but buried very deeply, she does talk about those supports and resources. And we see this is almost always the approach that we see to stories around youth mental health. So the counterbalance to this is moving the communications from individualism to contextualism. So how do we make this contextualized? Oops. So one way, and I think this is the key way, is to activate what surrounds us, shapes us thinking. This is also a fairly common and sometimes dominant mindset that people can bring to information. They might go to individualism, but then they might very quickly say, well, except, the places that we grow up, the things that are around us, whether it's schools, our family situation, finances, et cetera, that actually shapes our outcomes. So the ways that we activate this is to talk about environments and relationships and supports, instead of just individualistic stories, right? We can make community, we can make context, characters in that story. We can make places and communities and programs actually the protagonists of our stories, and then embed individuals within those stories. Always explaining the causes and how to address them and making those two things match up, right? So the cause and the solution match and are actually seem reasonable. You're not talking about causes that can't be addressed by your solutions or vice versa. And highlighting the efforts that have made changes to the context and how they improved health outcomes. So giving people that sort of understanding, that aspirational understanding of what can be done is really critical. So the litmus test for this is looking at a communication you're creating. Do you think somebody could walk away from this thinking that individuals are the cause of the problems and the sole source of solutions? Or do you think they could walk away from it understanding what the causes are and being able to see what the solutions are in your communications? And that's, just using that lens for your communications can be really helpful. So this is an alternative. I know it's not quite as snazzy as the previous one, but that shows you how you can actually do this in real time in an article, where it talks about a particular condition that's really critical to youth mental health and to youth thriving. So talking about school connectedness, for instance, and then you can talk about school connectedness and then again, embed a personal story about a young person who's in a situation where school connectedness really helped them. So the next one I want to talk about is fatalism. And I think this is something that, particularly in the context of the past few years, we are facing in terms of it being a real challenge for talking about youth mental health and how to address it. So what fatalism does is it makes people think, oh my gosh, this is just another thing that I need to be worried about. And I'll talk for a minute about crisis, but something that we often see is crisis fatigue. So again, especially in the past several years, there are so many crises that we have gone through that if people see one more, they kind of check out a lot of times, in part because they don't think we're actually going to change anything. They're really overwhelmed. And so this can come from a backfire, right? So one of the things that has been really critical, and I think particularly in this season where we're talking a lot about youth mental health, is this idea that we'll raise awareness and that's going to solve our problems. But when we raise awareness using certain types of language, like crisis language, we actually are depressing people's support for effective solutions and effective ways that we can tackle this issue. So how we fall into that trap: crisis language. And I'm going to show you a second in a slide that actually shows you the way this language is just everywhere all the time. It's very hard to avoid. And I'll talk about what you can do to avoid having to use the word crisis. Using stories and showing statistics that are really dire, that have visuals that are often sort of elevating this idea that it's very bleak, right? And that the problems are very deep, but not offering any solutions. And focusing on problems without talking about health and not talking about resilience, just talking about a mental health crisis or even mental illness is definitely problematic in terms of creating a sense of fatalism. And then relying on those most dramatic and those most violent examples, which we see quite often. So this is a number of examples about this crisis language and what, when you see these all together, what is this doing to people's minds and to their understanding of this topic and what they can actually do? It's actually not helping them think that there's anything we can do, because it's all about this really scary crisis that it's going to be essentially impossible to address if you look at this kind of language and you're constantly bombarded by these headlines, which people are right now. So talking a little bit more about the problem with problems and the problems with crisis language is the ways in which that balance that we want to create between people seeing an issue as urgent, but also having a sense that it can be addressed. So you'll see here that this sort of low efficacy, low urgency communication is the baseline. It's not really doing much of anything. But when we turn up that urgency without creating any sense of efficacy, people go straight to that fatalism. So that crisis language makes it seem urgent, and it maybe increases people's awareness, but it doesn't help them think about what can we actually collectively do to address this problem. Whereas if you get too high in efficacy, but not super urgent, people are like, oh, okay, that seems like something we can tackle. So I'm not going to get super engaged with this either. So we have to find that sweet spot where we're crafting communications that are high in urgency, but also give people a sense that there is something that they can do by giving them information like very clear solutions that they can grab onto. So I'll talk about that a little bit more. So the counterbalancing mindset here is pragmatism and progress. How do we do this? How do we balance that urgency and efficacy? Solutions, solutions, solutions. It is fascinating to me as somebody who's been working in framing for the past 7+ years, how often we see communications that have a problem statement, but then just leaves it there and doesn't provide the actual solutions for addressing those problems, and how difficult, we know how difficult it is for people to make that leap. It might seem, if for the people crafting the communication, that if folks just saw the problem, they'd understand it, but they don't, because they don't have your understanding. They don't have your knowledge. So you really need to lead them through to the solution. Using those values around pragmatism, problem solving, we can do this together in innovative ways, et cetera. There's various types of language we can use here. And telling stories about mental health. So not just illness, right? But actually, how do we build up health? How do we make sure that young people are going to thrive, as opposed to, again, like problem, problem, problem. We need to be more aspirational. So I like this quote because the sort of the way that the Surgeon General's report on mental health came out last year was very crisis focused in the way that it actually was rolled out in the sort of upfront communications. And we're also seeing that now with the most recent report. But if you look deeper inside of the communications and inside of the report, you'll see there's actually a lot of really great framing about how to address youth mental health. And so this particular quote, if we seize this moment, step up for our children and their families and their moment of need, and lead with inclusion, kindness, and respect, we can lay the foundation for healthier, more resilient, and more fulfilled nations. So that collective responsibility that's in there, that aspirational, we're going to help young people thrive, is actually a beautiful way of framing. So I wish there was more of that up front in that report and in those communications. So the last one that I'm going to talk about before we get into our conversation with Isabel and Primo is about otherism. So this is sort of, this is embedded in this us versus them thinking, which is very foundational to how human beings think about the world. But that is, we are able to actually push back on and navigate around with good framing. But what otherism is doing here is it makes people think that the problems that youth are encountering are just their problems, right? They're not adult problems. They are in a time of life that they just have to get through, and then they'll be fine when they reach adulthood. Or if it's really bad, they'll be damaged, and then they'll just be damaged adults. But this isn't our problem. So it creates this really low support for societal solutions. Oops. So what that leads to is, sorry, always an adventure here, is stigma and dehumanization. So again, like all of these articles, all of this idea that this is a crisis and people need to be aware of what a huge problem this is, can lead to people thinking about young people with mental health challenges as being other, right? And being really stigmatized and dehumanized. And that's not where we want to be going, because we already know that adolescents themselves are very stigmatized. And now these are a group of young people who we think are particularly damaged and problematic. So how are we falling into that trap? Well, as I showed you earlier with child mental health, that vulnerable way of framing young people, youth mental health is really problematic. And actually we see this across a lot of different projects where we talk about children and young people, that vulnerability frame actually backfires. When we remove agency from young people themselves, so tell stories about this issue without also talking about the fact that young people should have a voice and should be part of the solution. They're just kind of set aside as a problem that we need to address is really problematic. Using they, them, those language. So as much as we can, using us and we, and I'm going to talk about this in a second, is really critical to overcoming otherism. And talking again about young people generally and young people with, who are facing mental health challenges is just this uniform group that are sort of others, and that we either don't need to think about it, or if we think about it, it's in all of these negative ways. So the counterbalancing mindset from to otherism is collectivism. So to show you how we do that, so the first thing is talking about interdependence and collective responsibility. So we are, as a society, we all rely on one another, and we all have a collective responsibility to tackle, various issues, particularly issues that affect children and young people together, right? Because they're going to become adults, and we ourselves were adults at one point, which I'll talk about in a second. So that interdependence is really helpful. Thinking about how you're using pronouns and also labels is really critical. Emphasizing common experiences. So again, we were all young people at some point, right? And we all have commonalities as youth and as adults, and finding those places in our communications where we can highlight that can be really helpful. And again, show young people as active characters, right? So young people do have agency. They should have a voice. They should be part of the solution. And a lot of times our communications do treat them as this sort of vulnerable other group, and we take away their voice. So various examples of how you can do this, that's sort of a flip of those articles that I showed you before, which were very doom and gloom crisis-y, is highlighting the ways in which young people are working together to really, as activists, to change the world, right? To help each other, to help the rest of society to address some of the problems that we are all collectively facing. So these are the mindsets that I think are particularly problematic, and that we really need to find strategies to navigate around as we move forward with thinking about how we talk about youth mental health in more productive ways. And from this, I have sort of a series of what do we want to avoid? And these were also mostly in the earlier slides, but put together here. So those hero and savior stories that focus on individualism, not just of the young person, but of the people who might be able to quote unquote save them. we want to stay away from as much as we can. That's not to say that you can't tell individual stories, but they need to be placed within a larger narrative that is going to be more effective for social change. And I'll talk about the things we want to advance in a moment. Crisis language, to the extent that we can avoid that, we should. And I think at this point, actually anything that doesn't use crisis might actually stand out a little bit because we are inundated with crisis messaging. Showing long figures of statistics that are not framed and explained in any way is really problematic because you're making people more and more fatalistic as they see more and more negative data. They also often don't have any way of contextualizing the data. So if you're giving people data points about a particular group without any sort of contextual understanding of these are the causes, people will go back to that individualistic thinking or that us versus them or fatalistic thinking. We don't want them to go there. Making sure that young people have agency. These things aren't just happening to them. They are part of the solution. They can be part of what we collectively need to do. And of course, that them othering language as much as we can avoid that. And then what do we need to advance so that what surrounds us shapes us, like using characters, using examples, using context as a way of showing the role of our surroundings and our communities, et cetera. Centering communities. That example that I showed you was centering a particular school environment, right? School connectedness is sort of the central part of that story. Solutions, as I mentioned earlier, people need to know that there are solutions because they can't necessarily imagine them themselves. And using values like pragmatism and that sort of creating that sense that there's efficacy, that we can solve this problem to make sure that people don't become more fatalistic, that this is collective, that we're interconnected, and we're all going to see we all have a collective responsibility, and we're going to gain collective benefits when we work on this together as a society and with young people as a central part of that. Because young people need to be seen as active agents. They have the power to do this. And as we know from the adolescent development science, this is actually the perfect time for them to be involved in this, right? This is part of their development. So making sure that they're always a center of the story and are contributing to the story is really critical. So that's my presentation for today. I'm going to go ahead and take this down.
Great.
So I'm looking forward to our conversation.
Thanks, Marissa. That was really helpful. And now we are going to introduce Isabel and Primo. And rather, I'd really love them to introduce themselves, starting with Isabel. Isabel Ohakama is here she is a member of the Youth Scientific Council of Adolescents at the Center for the Developing Adolescent. And Isabel, maybe you could take a moment to tell us a little more about how you've worked on raising awareness or on this issue from a systemic level.
Hi, everyone. I'm Isabel Hakama. I'm currently finishing up my freshman year at the University of Virginia, double majoring in psychology and youth and social innovation. I'm really passionate about this topic. It's something I've been able to work with a lot of organizations to advocate for. Like Kate mentioned, I've been able to work with UCLA Center for the Developing Adolescent. But additionally, I've been able to work with the Bezos Family Foundation and the Aspen Institute, as well as doing research at UVA about youth mental health as well. This has been a passion of mine for a few years now. In high school, I was able to work with the Bezos Family Foundation to implement an initiative within my community or my school district more particularly to address the mental and emotional needs of young people, especially those who came from underrepresented groups. And so we're able to implement counselors, like mental health counselors on campus, so students could have free access to therapy on campus, which was has never happened in my school's history before. And we're also able to implement other things like yoga and just mental health reset days, and provide a community for students to be able to connect with others who were experiencing mental health issues as well. So it was really like a beneficial and impactful initiative, and it really jump-started my passion for this, especially being able to advocate for young people, especially young people who struggled with any sort of mental health issue like I did in the past. So yeah, that's a little bit about me.
Great, thank you. And now let's turn to Primo Lagasso-Goldberg, who is a social impact analyst and consultant at Hope Lab. And I know you've done some other work that I'd love it if you'd tell us about, Primo.
Yes, of course. Thank you so much, Kate. And thank you for your presentation, Marissa. I can't wait to discuss it in just a moment. As Kate said, my name is Primo Lagasso-Goldberg. My pronouns are they, them, and I currently work as a social impact analyst and program consultant for Hope Lab. But I sort of stumbled into this sort of realm and world of youth mental health, not on accident, but sort of tangentially. When I was in high school, you might have noticed one of the articles that Marissa referenced in her presentation was from YR Media, formerly known as Youth Radio. And I actually used to write as a youth journalist for YR Media when I was living on the West Coast. And I wrote a lot about youth mental health because in that community, I felt surrounded by other people who are articulate and considering identity and struggle and politics as it relates to mental health and identity. I felt very empowered to sort of write about my own experiences and very deeply consider how larger systemic forces such as climate change and policy and legislation, how these things impact young people's mental health. And through that writing, I was sort of connected with this world of youth mental health advocacy. And since then, I've had like mentors who have told me that like through this writing, you can develop a way of thinking and a way of problem solving that is very useful for folks, and that it would be just like it felt like a very natural course to turn that thinking and that writing into advocacy. And since then, I've done a lot of work sort of on the back end of things, like working with folks in the social tech sector to develop new programs and platforms and products for young people to uplift our mental health, specifically focusing on queer and BIPOC young people. And that's a lot of the work that I do with Hope Lab. And then also more on the front end of things. Marissa mentioned the Surgeon General's report that was released last year, and they held sort of an emergency convening of a lot of young people around the country. And I was able to attend that conference and meet the Surgeon General and sort of attend a lot of these different conferences around mental health in DC and in LA, and just talk to a lot of people, both folks who are my age and in college and younger, but then also folks whose job it is and it's their profession to advocate for us as young people. And so through all of that experience, I've really come to love and deeply cherish the sort of gaining momentum that we have as we're talking about how to advocate for youth mental health. And I feel like one of the biggest obstacles that not a lot of people talk about is this framing that Marissa talked about at length, and how we talk about the challenge of just dealing with these large systems. And so I'm very excited to weave that into the discussion today.
So speaking of discussion, next we're going to bring these three folks together to really have a short conversation before we get into audience questions. I know Primo and Isabel have some questions for Marissa, and she has some questions for them. And then I would invite folks on the audience, meanwhile, to keep entering your questions into that Q&A window, because we will get to those in the next segment. But for now, I'll turn it over to Primo and Isabel. I know you both have questions, so whoever wants to jump in to get things going.
I can start us off first, and then I'll pass it to you, Isabel. I think one question that myself as a young person who is not only professionally, but also personally dealt with a lot of mental health challenges, both for myself and in my communities as a queer person of color, I think something that I'm really wondering, and I think a lot of folks in the audience might be wondering as well, is in your presentation, you talked a lot about how we can reframe reframe how we discuss youth mental health away from words like crisis and away from vulnerability. And I think that is extremely valuable when we're talking about how we like talk between organizations, or at a very large scale, how we're presenting perhaps like campaigns to gather support for youth mental health from the general public. But how do we apply those same framing tools in our everyday lives, person to person, when it can be so much easier to sort of slip into the old habits of talking about it in terms of crisis and vulnerability when you're just talking like in a conversation with another person?
Yeah, that's a really great question, because you can do it in this sort of, I think you can do it intentionally in a conversation, but of course, when you're writing something down, you have a chance to kind of go back and redraft and think about how my framing is working. That being said, I think it is very possible, and you should be using that framing in personal conversations, by talking about addressing this in more aspirational terms, and also talking about what are the underlying causes, and what it is that we can do to actually address this. I think it's easy to get, I know I do this too, get mired in that like super negative, like, oh, this is a problem, we're not going to get there, there's nothing we can do. But raising up those like, well, actually, this has been really effective in my life, or in the programs that I've been involved in, or that I've seen elsewhere, and just lifting those up in conversation is really critical. There's actually a technique that we call bridge and pivot, where when people are going down sort of a path that we want to turn them away from, there's sort of bridge phrases that you can think of, that are things like, I've heard that too, but, or actually, I know that this program does this great thing. So you kind of create this little bridge and then turn the conversation towards the thing that you really want them to understand, in a well-framed way. So that's one way to kind of turn around a conversation, and then use that type of framing I was talking about. That being said, I don't want anybody to think that this framing needs to be used in a Pollyannish way, right? Like, this is a serious issue that we definitely need to address, and it is very urgent. And I think that's something that we definitely we should, and we need to talk about. But we also need to be bringing into every conversation, whether written or in person, the ways in which we can address it, and the fact that we have to. And we have to do it collectively. It can't just be on the young person to compartmentalize their mental health like it was in that article.
My question is really similar to Primo's, but it's kind of, how do we frame this topic when talking to like lawmakers and policymakers? As someone who's worked with lawmakers in the past, I think something I've noticed is that oftentimes they don't really address issues until it becomes a crisis. And obviously that's due to budget, personnel, just different like obstacles or hindrances. So how do we like really stress the urgency of this topic without making it seem like a crisis, so that lawmakers, policymakers, and like school district leaders or other people in powerful positions that, impact the lives of youth can like really understand the urgency and importance of this topic without making it seem like a crisis? Because obviously if it's a crisis, that like can backfire.
Yeah, that sort of the crisis awareness thing is also an issue when you're talking with decision makers. And I think acknowledging that this is incredibly urgent and important for our community, whatever that means in terms of the decision makers, whether it's their community of schools or if it's their, jurisdiction or whatever. So acknowledging that this is incredibly urgent, but also I think with people who are making those decisions, having some sort of understanding of what's the next step and what is my action plan is really, really helpful for them, right? Because then they know what the next steps are, and being, prepared with examples of what are the ways other folks have done this in other places, for instance, would be really helpful to kind of help in terms of showing them the ways in which this can be addressed, and it's been addressed before. And as a community, we can actually all do this together. So my interactions with decision makers is often sort of, okay, yeah, we know there's a problem. They know that problem part. They might not have a great understanding of why it's there, but their focus is very much on like, is there anything we can actually do? So I think preparing ahead of time with some really great examples of what can be what can be done that's workable, and having that sort of in your toolbox would probably be super helpful.
I have another question as well that sort of popped up just in the moment based on Isabel's question.
Mhm.
And I think you also touched on this briefly in the presentation, and this is something I've encountered in my own work as well, that there are so many different stakeholders in the sort of realm of youth mental health. And oftentimes I've had to, like both personally, but then when working for like a conference or various organizations, have had to use different language when talking to different stakeholders, because you have like policymakers and legislators, but also healthcare providers and also parents and teachers, and then the tech companies that are making social tech and mental health solutions that are accessible on your smartphone. And all of these people usually have very different sets of concerns, and also talk about the realm of youth mental health in very different, like some might call them users, some might call them patients, some call them students. And so with all of this different language, and obviously this is a very huge and difficult thing to unravel and pick apart, but any thoughts you have, even at the highest level, about how we can sort of begin to broach the fact that everyone who is concerned about this, or everyone who should be, uses different language to discuss how we're moving forward?
Yeah, and that's a big challenge, is how do you get everybody on the same page when they're using different words? I mean, one thing to say is that, and I think this is actually really important, is that framing is not prescriptive in terms of putting words in your mouth. Like there might be a value that actually, like, it is a word, like innovation, that you would want to use again and again, because we know it works and it has a particular meaning. It might be more useful for talking to policymakers than it would be for talking to parents or something like that. But using that framing strategy in flexible ways that actually work for the audiences that you are speaking with is the framing strategy is designed, is designed for exactly that. Not, you have to say this sentence that way or talk about this in this particular way. I think as an advocate, knowing your audience is really, really important. And then being able to use the frames in ways that match the way they talk, while still being, while still adhering to that shared framing. And I think the really important thing to think about is that if we're all using different framing strategies for different audiences, we're not going to move this issue forward, because we're not going to build that sense of collective responsibility, for one thing, which is what framing, when done right, does. It brings everybody around a particular understanding, a particular way of talking, but also a particular type of understanding amongst our audiences. But also it's confusing, right? So like if you're saying one thing to practitioners, but then saying something else to policymakers, and then they're communicating with each other and getting, it's confusing. And again, people kind of tend to check out when they're hearing a lot of different things from a lot of different people. So yeah, so I'd love to ask you all a couple of questions. And of course, you are the ones that are out there speaking to other young people, advocating in front of policymakers, et cetera, et cetera. And I'm curious, we've talked a little bit about these frames and what you're up against and how you might move people away from those mindsets. And I'm just curious about what has sort of really spoken to you in particular, and what you think you could use right now, or want to think about a little bit more, and maybe consider how you would embed those sorts of strategies in your own conversations. And Isabel, do you want to?
Sure. I think you made a lot of amazing points in your presentation. I really enjoyed it. I think the biggest takeaway for me and something I will be implementing when talking about this topic to other young people or other people who work with young people is steering away from individualism. And so kind of not having that token young person as like, you know, the hero. But I think also like emphasizing that it's important for young people to share their stories, especially, you know, stories with any sort of like mental health struggles or anything, but emphasizing like the importance of sharing the resources and systemic factors that they implemented in order to help them overcome mental health struggles, or like that even like contributed to their mental health struggles, because it kind of makes it kind of like frames it in a way that makes it seem like they weren't the only person, like it wasn't just them that overcame those issues, but it was like a system of other factors like family, community that helped them overcome those issues. And I do think that you brought up a really good point by emphasizing that, and that's something that I will definitely implement in other organizations that I work with.
Yeah, I can hop in as well. I definitely +1 to everything Isabel said, and I think what really stuck with me were those 3 categories of individualism and fatalism and othering. And I think they all sort of tie into something that I think about a lot when I talk about youth mental health in various contexts, and I always try to weave this in whenever I'm discussing it with no matter who I'm working with, what context, I always try to weave this in. And that is that, and then this will tie back in just a second. My brain is sort of going in many different directions. But I'm thinking of how I always want to stress to people that while I feel like one of the main narratives that we have around mental health for anyone is that it's heavily dependent and influenced by interpersonal relationships, which of course it 100% is. But I feel like that is taken to a very far extent where people think that what is causing young people stress is your friends or relationships or school or family, and all of that is and can be true. And I've experienced all of these as stressors myself, but that also diverts people away from realizing that while interpersonal relationships do have an impact on mental health, so does legislation, so does policy, so does climate change. Because if I can't, as a queer person, imagine a future where I'm safe walking down the street, that naturally is going to impact my mental health. If I see headlines on various news outlets about how they're signing legislation in the country that is invalidating my right to exist, that can only impact my mental health. And I feel like sort of how individualism as a pitfall, we sort of forget about the support systems we have. On the flip side of that, we also forget that larger systems can impact youth mental health. And even if it doesn't feel like, legislation at the federal level is going to impact young people's mental health, it 100% does, because it's so visible on social media. And so sort of using those 3 pitfall categories that you talked about, not just to think about how we can frame solutions for youth mental health, but how we can also frame the sort of roots of the obstacles to young people's mental well-being as not just interpersonal, but also systemic, and really and climate change and legislation and policy. All these things also impact our mental health to an equal extent as interpersonal relationships do.
Well, thanks to all of you. I know this discussion could be rich and go on forever. I want to just bring in some audience questions for you to consider as well, because we have a few really great ones. So if we can maybe bring everybody in together to talk about these. The first one I wanted to lift up was, we had some good questions about balancing some of the advice, and also would love to know from from Prima and Isabel how this factors in for you. But this question is about how you balance giving young people agency and incorporating their voices with incorporating the voices of caregivers and parents and others who are sort of concerned and maybe good advocates. Just curious, both from the research angle and then from the advocacy angle, how you all think that shakes out.
Yeah, I mean, I actually think Isabel and Primo will have maybe better answers to this through their advocacy. But I I think just from the framing perspective, the sort of the more stories you can tell that use the same narrative and the same framing strategy, even if it's different, whether it's young people or family members or educators or healthcare professionals sort of at the center of those stories. What's really critical is that they're using the same kind of framing and not telling stories that actually come head to head. And I think also something that's always really critical that unfortunately we see a lot of is not just the individualism in terms of a young person is solely responsible for their own mental health, and if they don't do well, it's on them, is the family shame and blame. And so I think caregivers have an incredibly important voice in all of this. And we need to make sure in all of the narratives and stories that we're telling that supporting them collectively is incredibly important, and maybe just as important as supporting the young person themselves or young people generally. So.
I think that this question is really interesting. I think that there's a stereotype that when people reach adolescence that they don't need their parents, or like that they don't need their parents as much. And I do think that that's false. I think young people still need support and guardianship from their parents or adult mentors in their lives. They just need it in a different way than when they were like, 8 or 7. And I think that for adults, so parents, educators, and mentors who work really hands-on with young people, it's understanding that the relationship with an adolescent does change from when they're younger, and understanding how to navigate that relationship and being there to talk to them and give them advice, especially when it comes to their mental and emotional wellness. And also like really emphasizing that you're still there for them, even though, they may be more independent, but you're still a very supportive presence in their lives. And yeah, just kind of being there as a shoulder to lean on, and also giving advice. I think that's another big thing. So I think it is really important to kind of steer away from that stereotype that as someone kind of emerges into adolescence, that they need their parents or adults any less, because that's far from the truth.
I think I'll just add something quickly at the end, and that is that I think in these conversations, it's very easy to forget how simple agency can be. And I think that for me in a lot of my work, and I'll use a quote that a lot of other young people in this space use, and that is nothing for us without us. And I think it's as simple as that, just because you can, like, I encourage everyone to in these conversations engage parents and guardians and teachers and mentors, but also engage young people. And if you are talking, and I think a lot of people end up talking to parents and then conflating the parents' opinions as the opinions of their young people, because their parents must know their children very well. And I think in a lot of cases that can be true, but there are also many cases where that is not true. And so the best way to ensure to strike that balance is to, if you're interviewing 5 parents about youth mental health, interview 5 young people, interview their 5 children about their mental health. And that automatically provides agency for those young people, because I think one of the simplest ways of giving someone agency is allowing them to speak personally about their own experiences and not filtering it through a second party.
Thanks, everybody. Next question, I think, really builds from something I think Primo was saying earlier. Really good question about, by focusing on mental health, do we lose the opportunity to talk about root causes, or how rather can we bring root causes into the conversation? And especially thinking about different groups of young people, and how in many cases just lack of opportunity or barriers caused by discrimination or other kind of obstacles really do affect mental health, do create stress in the lives of young people and their families. How do we bring that into a conversation in a solution-based way, and in a way that also doesn't lose the particular issue when the particular issue is of concern?
Well, I guess I will start, but again, I'm really interested to hear what Isabel and Primo have to say. So I think in terms of the first part of what you talked about, which is about health, we do have ways of that we know works really effectively for talking about what we need for young people to thrive as they're becoming adults. And I do want to just, because somebody asked this in the Q&A about what age group we're talking about, and at least for the purposes of the framing research that we did, it was 10 to 25, which is sort of the standard length of time or period of life that adolescent development scientists now use as adolescents. So talking about what it is that young people need to thrive is a big part of the framing strategy around adolescent development. But when you're thinking about particular groups of young people, in particular groups of young people of color, LGBTQ young people who are facing circumstances that are different in many ways from other young people and are maybe probably even more urgent when we're talking about mental health. There's an approach to communication that we often call targeted universalism, where we found that sort of setting up a conversation, setting up a communication by talking about what it is that all young people need to thrive. And then, youth who are facing mental health challenges, young people of color, et cetera, need more supports because of the challenges that they are facing, in particular, because of their circumstances, because of discrimination, because of racism, because of homophobia, et cetera, et cetera. So using that sort of entryway in terms of how do we make sure that all young people have strong mental health and well-being, but talking more specifically when we have a focus about what it is that particular groups of young people need even more, and maybe more specifically, is the way that we approach that with the framing recommendations.
I can hop in next for this question, because I think, like you mentioned, Cate, it does relate to what I was saying in an earlier question. And I think that for this question of balancing or losing sight of sort of these root causes, in the ideal world where we are tackling this world of youth mental health, in the ideal world, we're approaching it from a very holistic place where any one person, whether it be a policymaker or a healthcare provider or a teacher or parent, all of these people are thinking about how all of the elements and factors in a young person's life are impacting our mental health. And so the sort of Thrive by 25, the list that I think was mentioned in the Q&A, I think all of those things need to be folded into and become a part of addressing mental health. And it's not an easy thing to do, because I think, and this is what a lot of folks do now, is it's very easy to sort of think of mental health as its own sort of floating category, that like, let's design solutions specifically for mental health, let's focus on this problem, and then someone else will make sure that you have basic needs, or like, community and financial stability, and that's someone else's job. But what should really be happening is everyone should be talking to each other about how to design solutions for this whole system, because like I think what this question is getting to is that things like basic needs and financial stability, education, all of these also impact young people's mental health. And so if the problem that we're trying to solve is a multifaceted one, then our solution should also be multifaceted, and we should be thinking about all of these things at once. And like I said, this is not an easy thing to do, especially at the systems level, because there's so many different moving parts. But I think that is one of the challenges that myself as a young person, as an advocate, is trying to help adults working in this field think about, is how do we effectively balance all of these things that have an impact on a young person's mental health, and design solutions that are talking to one another and that are influenced by one another in the same way that the challenge of youth mental health is influenced by a lot of different things.
I'm really just going to echo the words of Marissa and Primo, because I think they were pretty spot on. But I think it is the responsibility of any practitioner or any person who works with young people or works for young people to consider young people of color, queer young people who are immigrants or first gen when implementing any kind of solution, because typically young people from these underrepresented groups have unique non-shared experiences. And so it's really important to consider them when implementing any sort of innovation or solution to any sort of issue or target area. I think a really great way to do this is kind of anytime you're trying to create any sort of solution, asking for the input of young people, but not just young people that represent majority groups, but also young people from underrepresented groups, because it helps you just kind of ensure that whatever solution you're trying to create or present can be applicable and can be something that can be used for by like all young people, or at least you're creating a type of solution that like young people from different underrepresented groups can access as well. So.
Great. Well, thank you all. Think we have time for one more question before we turn to some wrap up. I'm going to combine a couple of questions into this one. And it's really about some specific use cases of how would you actually present a good data chart to get into this issue? We've talked about sort of the overwhelming nature of the trend lines, the negative trend lines. What is a good way to kind of present some data visually? And then we also had a question about writing a needs statement, say for a grant, when reports are kind of structured in a way that takes apart the framing in maybe unhelpful ways. How can you use both of these vehicles and apply some of the framing advice and also the on-the-ground life experience advice that our panel has?
Yeah, so I think so when presenting data, the critical thing is that you always set it up so that people are focusing on what the data actually is showing in terms of the meaning for you and your organization and for the field, right? So a lot of times, and I see this sometimes, well, when I was using Twitter, I don't use Twitter anymore, but when I used to use it, people would like drop a graph in about a particular social issue having to do with poverty or something like that, and then say, this data speaks for itself. Well, I might look at this data, which say, is showing, poverty rates for particular groups of people and say, because of the knowledge that I have, and certainly the knowledge that they have, oh, this is like serious inequality and lack of opportunity. Like this is a symptom of something really bad and pervasive in our society that we need to address. Somebody else might come at it and with a very discriminatory us versus them lens and go, well, those people are clearly at fault for whatever I'm seeing in this data around poverty. So making sure that you give people the causal explanation for that data immediately before you show the data is really, really important. So actually, when I showed you that graph, which I was explaining in the moment in the slides, if I was just showing it in a report, I would, and we do in our reports, have a whole description of what that thing is about so that people understand it the way I need them to understand it. So that's the critical thing. It takes a little more work, but you can't just drop data. You need to really contextualize it. And then the question about grants, that's a good one, because I mean, I have to write those sometimes myself. And in those, you're not necessarily going to be able to tell like sort of a perfect story, right? Because they're chopped up. The thing you want to do, and I think this is the case for all communications, using a framing strategy, again, not just grants, but anything that's sort of public facing, is that you're weaving the framing throughout. Like you're finding those opportunities where you can really do a great job of framing, or think about, oh my gosh, am I reinforcing something that I didn't mean to right here? And how can I turn that around and flip it around? So, for grants, that's maybe a little harder, but thinking about how you can use the innovation language or move away from, we're trying to address this issue of vulnerable young people, and moving your language away from that, I think is a really good strategy for that. knowing what you're up against is half the battle. Being able to recognize it in your communications is such a huge, important part of thing. Almost as, yeah, maybe equally important to knowing what to do is what you need to avoid.
I think I have a little bit of insight when it comes to like presenting data, especially to people who work with young people. And this kind of ties back to what I believe Prima mentioned earlier. I think it's also kind of knowing your audience. So like Marissa mentioned, it's really important to give context when providing data, but also knowing who you're talking to when providing that data is crucial as well. So for example, like if you're presenting something to law or policymakers, like having 5 pages of data may be nothing to them because they're used to going over data and analyzing data often. But if you're presenting some kind of solution or just any kind of presentation to a group of parents, like maybe having 5-10 pages of data is just not as feasible. So I think just knowing your audience and knowing how to disseminate your information in a way that's applicable to your audience may also be the best way when it comes to like data. So that's like my little 2 cents on that.
And since I know we're almost at time, I'll keep my answer. I can speak to the grant writing aspect of it. And I think that something, as someone who has for amazing and very fortunate reasons been in a position to review grant proposals as a young person, which I think is really cool. But then also as someone who has crafted grant proposals, I think in my like writing them myself and reading a lot of them, I think in a lot of cases, people rely very heavily on the need statement to articulate what or why this grant proposal should go through and why it should be accepted. But like Marissa said, it is much more effective and also sort of lessens the pressure if you approach the proposal holistically and are folding that framing into even the title of your proposal, like the introduction, the institutional background, your objectives, like the methods and implementation. Even like in the future funding and sustainability questions, pay as much attention to how you're crafting those questions and the language you're using as you are in the need statement, because hopefully whoever is reading your grant proposal is reading the entire thing and reading it carefully and thoroughly so they can make a very informed decision. And if they are doing that and you do your due diligence to incorporate positive framing and everything that Marissa talked about, it's okay if you sort of fall back on more familiar language in the need statement, as long as you know that overall you're like, if you can imagine the whole grant proposal as a vibe or as a tone, if that tone is one of empowerment and one that is very positive, and you're using the lens of framing that Marissa talked about on the entire grant proposal, I think that can be very effective and will take some of the pressure off of like, oh, I can't use this one word in the need statement because like Marissa said, it's not, we're not telling you what to say or exactly the words to use. It should be flexible and it can be scaled to one section of the proposal or the entire thing.
Well, thank you all very much. And thanks to everyone. We are running out of time, but I did just want to close by bringing up a quick checkout question to see if you all would like to reflect in the chat as we are checking out. We're kind of interested in a little post test about what we've learned today. What are 1 or 2 words after the presentation that you think you might use in the future based on what you've heard when talking about youth mental health? What is resonating with you in your context as you leave this seminar today? And then as you all are entering that, I wanted to bring up our very last slide, which is just to leave you with some parting resources. I see collective benefit, I see uplift, solutions, great stuff. And we have a couple of things. Frame Works has created a tip sheet on this issue, which is available at their website. And I think our events team is going to drop the links in the chat to both of these resources, but they will also be available on the slides, which will be posted later at aecf.org. So you'll be able to take a look at that tip sheet. And I also wanted to call attention to our 2022 Kids Count Data Book, which had youth mental health as a signature topic and had some good data and recommendations. And I also want to make sure everyone knows that our 2023 Kids Count Data Book will come out in just a few weeks in the middle of June. So please stay tuned for that. And so I'll give you all a minute to copy the links from the chat. And I want to thank our panelists, Isabel, Primo, and Marissa, as well as all of you for your time today and your great questions. We hope you have a great afternoon. Thank you very much.